Hi, everyone. Welcome to Asian Services in Action. My name is Tamor Rashid. I am the Community Health Promotions Coordinator and Quality Data Analyst here at Asian Services in Action. And I'll be giving a brief introduction of who we are, what we do, who we serve, and some of the projects and initiatives that we have going for us right now. So Asian Services in Action is a 501c3 nonprofit organization serving Northeast Ohio. We primarily serve the Asian American Pacific Islander community here and other underrepresented, underserved, low-income immigrant and refugee community members as well. We have two locations, both in Akron, Ohio, which is in Summit County, and Cleveland, which is in Cuyahoga County. And we serve about 58,000 clients annually through both locations. Central to what we do is our mission. And so our mission is to empower and advocate for Asian Americans and Pacific Islanders and to provide AAPIs and other communities access to quality, culturally and linguistically appropriate information, health, and social services. We have a fundamental focus on health equity, and we operate and see things through a health equity lens. We strive to identify and address health inequities, in order to improve health outcomes of our community members. All of the programs and services that we provide are provided with health equity in mind. The communities and areas that we serve. So we serve 18 contiguous zip codes in Cuyahoga and Summit counties. In Cuyahoga County, the AAPI population is around 47,511. In Summit County, it's 22,473. Majority of our community members are in the Akron and Cleveland areas, and so that works out well because we are located in Akron and Cleveland as well. So most of our community members are limited English proficient. They represent about 88%. Most of them are low income, medically underserved, underrepresented, Asian immigrant and refugee community members. So the immigrant and refugee community members come from all over the place. Afghanistan, Bhutan, Burma, Nepal, the Democratic Republic of Congo, China, Syria, Iraq, Vietnam, just to name a few. And, we provide culturally and linguistically appropriate services to very diverse community members and population. Without the services that we provide, many of our community members, would be negatively impacted. And so we really take pride in the work that we do, in the partnerships that we have and cultivate with community members, community leaders, community stakeholders, and other organizations and agencies, both in-state and nationwide. Some of our programs and services, our bread and butter basically is the International Community Health Center, and we operate two of them in both Akron and Cleveland. They are federally qualified health centers, serving, total between the two, 5,883 total patient visits over the past year. And we offer comprehensive primary care services. So internal medicine, family medicine, pediatrics, women's health, behavioral health, HIV and STI testing and treatment. And we'll also be prescribing PrEP soon as well. Lab services, referral services. ICHC is central to not only the comprehensive primary care services we provide, but also the other services we provide as well. And so, addressing health inequities is much more than just providing healthcare services. It's engaging with the community. It's understanding communities' needs and concerns, and catering to those needs and concerns in order to put community members in a position to take control of their lives. That can ultimately positively affect their quality of life moving forward. Other programs and services that we provide are children, youth, and family services, interpretation and translation services, legal services, sustainability services, financial services through the Apex Fund for Economic Opportunity, aging and adult services, domestic violence, sexual assault, and human trafficking services through AHIMSA, policy advocacy and civic engagement programs. And so, we offer a wide range of services, working together with community members to address social determinants of health, to address inequities, and promote health equity for everyone in the area. And that just goes along with our mission. Some notable projects and partnerships. So, relevant to the summit is our Tuberculosis Elimination Alliance mini grant project. We have really high rates of TB in Summit and Cuyahoga counties. 71.4% of active TB cases in Summit County are among Asian immigrant population. And so there's a general lack of TB screenings, vaccinations, and adequate health literacy. And this is due in large part to language barriers, cultural barriers, and cultural stigma. And so, two of the main goals of this project are to increase knowledge within the immigrant and refugee population about TB, their diagnosis, and the importance of follow-up. Second one being connecting immigrants and refugees at risk of TB to our International Community Health Center for screening and medical care. Another one that we have going on right now with APCHO is the COVID-19 CHW National Workforce Access Program. And the goal is to really increase community access to the COVID-19 vaccine through increased CHW mobilization and reach. And a big part of this is standardized data collection. So APCHO has provided us with a HRSA compliance survey, measuring responses from community members who are receiving the vaccine. Here at Asia, we wanted to take it a step further and use those surveys to measure responses from community members who have not been vaccinated and also who have already been vaccinated, sort of seeing some of the community specific factors leading to both of those things. And this project is ongoing. The grant has been extended until May, I believe. And so, we're already seeing a lot of real-time data providing us some pretty good insight into those community specific factors. Lastly, our International Community Health Center telehealth pilot project done with the Cleveland Foundation. As I mentioned before, 88% of ICHC's patients are limited English proficient. And so COVID-19 kind of complicated our ability to reach and engage with those patients. And so, a modified telehealth approach was necessary, and it's a twofold project. Part one would be the traditional telehealth program for 25 high-risk patients with full language interpretation and translation services. And so we provide phones to all of these patients and take their blood pressure and blood glucose readings. I mean, they'll do that at home. They report those to us remotely, and we track that data. The second one is the on-site telehealth-like practices that respond to our patients' preference for in-person healthcare. And so, we know that community members oftentimes prefer being met in person by their provider. And so, taking their safety into consideration, we schedule them for an appointment. They come in a safe, socially distanced environment, and they have an opportunity to learn how to use telehealth services, interpretation services, and translation services, and speak to their provider on site. ICHC staff are also there to help them out and assist them in any way that they need. Should their provider deem an in-person visit necessary, they will be seen that day by their provider. And so, it's a really interesting project. It's still in the implementation phase right now, but we're really looking forward to moving that project forward. And so, if anyone has questions about the organization, about what we do, about what I do, please feel free to reach out. I've provided the website. It's www.asiaohio.org. I've also provided phone numbers for each of our offices and international community health centers. Again, my name is Timur Rashid. It's been a pleasure speaking with everyone today. I'm looking forward to meeting with all of you. And again, if you have any questions, just throw them my way. I've provided my email address at the bottom of the screen. Thank you so much.